دقيقة let's mute. Can you check the link? See, because
Assalamu alaikum. Good morning, ladies and gentlemen. Good morning, my colleagues, executive directors, and CEO of King Fahd Specialist Hospital, Mr. Sharif Umar. It's my pleasure to introduce to you the monthly general staff meeting for March 2021 at King Fahd Specialist Hospital in Dammam. First of all, I would like to thank the hospital administration for the sharing the hospital update and latest with the employees. And at the beginning, we'll start with the CEO of King Fahd Specialist Hospitals and his speech, Mr. Adnan.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Sabah al-Khair. Thank you all for joining us virtually once again. Inshallah, one of these days we'll be able to join once again in person. But thank you for joining us for the general staff meeting for the first quarter. As you can see from the agenda, we have a variety of different topics. The first is we'll cover our results from the previous year. Obviously, the volumes and the outcomes are slightly skewed because of the pandemic and the impact that it's had on hospital operations. But then beyond that, moving into 2021 performance improvement competition that is ongoing. I'll say now, and inshallah, in case I don't forget it in the future, something else we have ongoing right now is our patient safety survey. Alhamdulillah, we've had good results so far. We're about 68-69% participation rate. Our goal is 70%, which is about 20 more surveys. So I would encourage everyone to, if you haven't done the survey yet, please do the survey so that we can achieve our target, and more importantly, get your feedback so we can understand where some of the concerns are from our staff regarding patient safety. From there, we'll move into ongoing COVID preparation. Obviously, we want to make sure that our patients continue to be safe and all of you continue to be safe. And so we'll have an update on ongoing preparation and additional information regarding vaccine, and then additional updates on hospital projects, some that are ongoing and some that will begin over the next couple of months. And then finally, we'll move into more of a global transformation update relative to the clusters transformation and how KFSH fits into that. And then finally, our standard appreciation of the champions that were acknowledged by our patients throughout the first quarter, as well as questions from the previous moment. So with that, we can move into our first presentation on operational KPIs.
Thank you, Mr. Sharif. Assalamu alaikum wa rahmatullah. I'm Rawan al-Rabi'a, Acting Head of Physician Support Department in Quality and Strategic Planning Administration. So today I'll share with you a snapshot of what happened during 2020 operationally. Of course, as we all know, 2020 was a special year for us all, and it reflected on the operational data with a decrease in many of our operational status. Let's start with our ambulatory visits. As you can see, we started the year very well, and then we had a drop during the COVID months, the strict COVID months, starting from March to July. And then from August, we came back and started the normal operation. There was a decrease of 16% in the overall OPD visits. But as we all know, there was virtual clinics going on at the same time. So starting April, we have started the virtual clinics, and it increased until September. It became decreasing, and there was an increase of the physical visits. In the emergency medicine, there was a decrease of 13% in the EMD visits. Almost 46% of our admissions were through ED. In our OR, there was a decrease of 26%, of course, in our OR procedures. As you can see, during the months of COVID, there was a huge decrease, and then we came back to normal with September. Our OR utilization have decreased by 19%. on an average, we have 72% OR utilization in 2020. Our admissions, and in average, we have admitted almost 2,000 patients per in the year. And as you can see, there was a decrease during the months and then came back to normal with September. Most of our admissions were oncology center patients. After that, surgical services patients, and the other centers follows. Our average length of stay is on average 5.8 days. There was a decrease, of course, during a big chunk of the year. The adjusted average length of stay is 6.4 days. Sorry, there was a decrease of 0.15, which is not that significant. And finally, our eligibility and medical coordination department referrals had a decrease of almost 30% referrals. We have accepted in 2020 almost 5,000 patients compared to 2019, 9,000 patients. Thank you all. All details are available in the year-to-date report in the portal. You can go to the past link, QSPA DSD, and then year-to-date report. Thank you all.
Thank you, Mr. Rawan. Now, we'll be with Ms. Uday Salim and his topic about the 2021 Performance Improvement Competition.
Assalamu alaikum jami'an. Good morning. I'm here today to announce the quality improvement competition for this year. As you know, we started this back in 2017, where we started this competition to provide training to the employee about quality tools and encouraging them to use it in their daily practice. So in 2017, we started focusing on PDCA cycle. Then 2009 to 18, we started to talk about identification waste and lean. In 2019, we used both methodology. Unfortunately, 2020, we had no competition because of the COVID-19. But this year, we will focus on lean, but another two tools. They are simple, yet very powerful in achieving efficiency and safety. We are calling 5S and visual management. The advantage of 5S and visual management for the staff that they did not require data collection. So basically, what is 5S? We will not go into the methodology. It's a 5-step technique that help in achieving efficiency and safety. So for example, if you have a storage area or you have a physical tools like physical therapy, laboratory, nursing units, operating room, then 5S definitely will help you in organizing your workplace in a way that achieves safety and efficiency. Now, 5S is not only about storage. If you have a backlog, for example, if you have a backlog of radiology requests or operation room requests, then 5S definitely will help by sorting these requests, setting them in order, prioritizing them, deciding which need to be done, which need to be done now, and which can be done later. So this is 5S. Visual management, simply, it's how you make your workplace visual in a way that you don't need to explain it. So for example, you can use stickers, colors, tags to make sure that the equipments are in their places. Okay, you can use visual management to ensure medication safety, so it's easier for the patients. You can use visual management in IT or in any other discipline. And in some hospitals, they use the visual management for gauze counting in the OR. Okay, so this part of lean requires a lot of innovation and creativity. So this is your place now to show us your creativity and innovation. Now, we started the training for 5S and visual management 3 weeks ago through Zoom. It's 1-hour session that's repeated twice a week. We managed to train 50 participants till now. Training is still ongoing. And we need more attendees to make sure people are trained about this methodology, because we need more ideas and more projects in the future. So these are the deadlines for the competition. Just check your emails, see all the rules and the announcement. hurry up, and in November, inshallah, in the International Equality Day, we will have a recognition day for the best performance improvement projects. And thank you. That's all.
Thank you, Mr. Salim. Now we'll be with the part of COVID update and Ms. Manal Naimi.
Assalamu alaikum, everyone. Good morning. As part of our efforts to update you regarding COVID-19 development. Yeah. All right. Okay. So, assalamu alaikum. Good morning, everyone. As part of our updates to update you regarding COVID-19 development, a task force has been created to on the 2nd of February to include a multidisciplinary team on a daily huddle. That includes the members from clinical areas, operations, and quality, in order to come up with the precautionary measures against COVID-19, update them regularly, and update the contingency plan against COVID-19. On the 25th of April, the COVID-19 contingency plan has been updated. You will be able to find it and access it on the portal. We have tried for this version to be concise, user-friendly, and to answer most of the common situations that you may face, and to answer most of your frequently asked questions. You will see that the update has highlights in yellow that are the new updates from the last version. Also, you'll be receiving tips such as these from the QSPA on regular basis to answer your usual inquiries and and situations that you may face during the COVID-19 pandemic. We've also updated, according to input from our members and the multidisciplinary team, some stricter guidelines regarding outpatients and inpatients. So notably, crowding has been noticed in the outpatients areas. We have encouraged that you shift to virtual clinics as much as possible without compromising patient care, and restrictions have been made over companions, with one companion per patient if they are incompetent or in a pediatric age group. Also, an SMS has been sent to patients to update them regarding these changes. As you all know, there has been suspension of visitations in order to protect you and to protect our patients from any risk of developing COVID-19 infection. This has been started around 2 weeks ago, and it will be modified as the pandemic develops. There has been also restrictions on companions for patients, including a documented visual triage done by our nursing for companions, and the discouragement of switching of companions. Furthermore, there are certain updates that are you will notice in the COVID-19 contingency plan, which is the updated visual triage. That it goes in accordance with the new updated visual triage on Wiqaya. Also, there has been changes in the emergency room patient flow. That includes absence of the IRU, so there's different now ER zoning than what you've been used to in the beginning of the pandemic. Furthermore, rapid testing is now available 24/7 in the ER for emergency patients, critical patients, and transplant surgery patients. And the transportation processing is explained clearly in the contingency plan. Furthermore, there are some situations that you face on regular basis, such as recovery of from non-COVID-19 infection and return of infected healthcare workers. We have clarified that further in a simple manner in the contingency plan and added flowcharts to make it more user-friendly for all of you. Furthermore, on the 3rd of March, COVID-19 vaccines have been available for our staff in Building 13, Classroom 2. We encourage you to vaccinate, to protect yourselves and protect your families and patients. It is available to all KFSHD employees and their dependents over the age of 40. You'll need to download and register in the Sahati app and organize with your direct supervisor to schedule an appointment. Stay safe, and we thank you all. And in the end, I want to thank the team that has contributed over the past 3 weeks for this task force and continues to do that, and all the guests that have come from the blood bank and the microbiology lab. Thank you.
Thank you, Ms. Manal. Now we'll be with part of the hospital project update with engineering Sultan Fatouh.
No. Assalamu alaikum. Good morning, everybody. I'll give you update about the project that had been completed, under construction, and just awarded. I will start with the completed project. Alhamdulillah, we just launched the ICSDU project this week by Mr. Sharif and the donor. This is 6 ICU rooms, just launched this week, and it is under operation now. The project was it's fabricated project, modular system. The whole room is sealed, and from the walls up to the ceiling. Second project, the courtyard. The courtyard is completed. All of the 4 courtrooms, the rest area, and lounges. And this is the after construction. The third project, building 19. Alhamdulillah, we just finished the building last 2 months. And now most of the staff and administrative has been transferred to this building, which would give us more available spaces inside the hospital, which we can use it as the medical areas. Third project, it's the MRI 1.5 Tesla, and we just completed in the last 2 months. The project is now completed and it's under operation. We have some project under construction. It's continuous from the last year. For example, the sprinkler system, we reached up to 40%, and now we are working in the 2nd floor. The electricity power for the whole hospital, the increasing power, now it is 40%. We have completed the major area, the cabling, the earthing, the building of the power station, and now we are ready to receive the power from the electric company to increase the power. The remaining of the project for lighting and grounding of all the building, and also changing the old panel board for administration and the housing unit. The stem cell lab, it's in the basement. This will create a good environment for the lab, and we are reaching 40%. And we're expecting, inshallah, end of this year to be completed. Transferring 3 rooms from admin rooms into bedroom, into patient room. We just handed over the project last month, and now we are reaching up to 20%. Abbott, we have finished the first phase, the automated lab. In the first phase, it's already finished. The next stage, which is the admin offices and other services. This project for the ICU and kitchen. The kitchen is already completed, and now we are working in the ICU pharmacy satellite. It's around 80%. We are expecting to be completed, inshallah, within next 2 months. This is the 3 Tesla MRI. The completion is 90%. Also, it's expected to be completed in the few next month. For the project that we just handed over, and now we are in the process to hand it over to the contractor, the site. The blood bank, transferring the blood bank from building 100 into building 15. This project, it will be just transferring the location, and it will give a good service to the blood bank people and to the donor. We have some small extra bed. The second project we just awarded the warehouses of the OR, and we are in the process of handing over the site to the contractor. This will give 2 more rooms in the OR, which will be evacuated, and inshallah, we will start doing the maintenance job for the current OR room. The last one, the short stay, which is near to the ER, it's 8 patient rooms. Same, we just handed over we just awarded, and we are in the process to hand over the site to the contractor. All of these handed over, we are working in the shop drawings and the detailed design and selection of the material. We are expecting, inshallah, 2 more weeks, and he will start the actual construction at the site. Thank you. And we just have a small video to show you the SDO.
مشروع العناية المركزة مستشفى الملك فهد التخصصي بالدمام يتميز بضم العناية المركزة عن الأنظمة التقليدية القديمة لأنه نظام ديناميكي مرن يمكن فكه وتركيبه وإعادة تخطيط الغرف حيث الحجم والعدد حسب الحاجة. لذلك هو الخيار الاقتصادي الأول لإدارة المستشفيات. الجدران والسقف والأبواب والنوافذ في نظام AKM مسيج واحد متراكم يشكل كبسولة محكمة الخلق تماما لا تسمح بتسرب الهواء كأحد انتشار العدوى. السقف في نظام AKM شديد التحمل يقدر تجول الأفراد فوقه لإتمام كافة أعمال الصيانة من أعلى دون الحاجة لفك السقف وتوقف الاستفادة من الغرفة كما في النظام التقليدي القديم. نظام AKM يضيف لمسة جمالية للتخفيف عن المريض. AKM نتفهم احتياجاتك.
Thank you very much.
Thank you, Engineer Sultan. Now we'll be with transformation update and Mr. Sharif Adnan.
Assalamu alaikum again. I'll give a quick update. This is just intended to be a introduction for exercises that will begin to kick off. From a cluster perspective, from an Eastern Health Cluster perspective, there was a significant milestone that was accomplished last week. Over the past really year, the cluster has been working on developing a 5-year strategic plan, which is an important component to advancing to becoming an ACO. That long-term strategic plan was approved by Health Holco's board last week, and now begins the process of beginning the rollout phase of it. The strategic plan was developed in conjunction with hospital leadership, staff, and cluster leadership, and really is comprised over a lot of different areas. The ultimate goal of the plan is to take the current workforce, the current health environment that's today, and you can see this illustration of all of our grandmothers in the middle of our health environment, and really having to kind of guide their own healthcare, figure out how to navigate through the health system, depending on, if it's primary care, tertiary care, ancillary services. There's gaps in our current care process. And the strategic plan really focuses on 5 key objectives, which is first looking at how do we truly move into an ACO, which is more around the prevention part of it. So really, how do we begin to introduce healthy behaviors within our community? And how do we really focus on screening? And from KFSH perspective, this is a critical component because we are the end results of some of the lack of prevention, particularly in the world of cancer, where we see a high breast cancer rate, high colon cancer rate, And a lot of it is tied back to the lack of screening that occurs on the very front end to try to catch cancers earlier in the disease process. Second, moving from prevention, a focus of the long-term strategic plan is around access, which is really how do patients enter the health system. This section really has a heavy emphasis on primary health, really making sure that as a cluster, we have a strong primary health network that our community trusts, that's accessible to the community. And there's a lot of details in this section around different primary care formats, whether it's urgent care, your traditional primary care, mega centers. But then beyond primary care is how do patients then access the different health system, whether it's a general acute care hospital, a specialty hospital like us, treating them in the appropriate settings, making sure we have robust home health services, digital enablers. The third part of the strategic plan moves into the governance section, which is really how does all this come together? How does KFSH interact with the cluster? How does KFSH interact with other acute care hospitals? How does KFSH interact with other clusters where we know a substantial number of our patients come from outside of the E1 cluster? And then also focuses on quality of care. And while we make all these changes in prevention and access, how do we ensure that we're still providing high quality of care? And then that moves into number 4, which is really focused on efficiencies, ensuring that while we do these items, improving quality, improving prevention, that we're realizing cost savings through that process. There's additional emphasis within the value base that focus on gaps that we don't have right now. So for example, coding is a critical component that while KFSH has it from a cluster perspective, it's a huge gap. And as we move into more of a ACO setting where we have to begin to have claims and ensure that our doctors are documenting appropriately, this becomes a critical component. And then finally, the 5th one is all of you at KFSH and all the 23,000 employees within the cluster. How do we make sure that we have healthy environments for our employees to work in, but also engage our employees in understanding what the new world looks like? What are the new jobs that are created, through this plan? It's anticipated that to do prevention right and to do primary healthcare right and to have health coaches and coders and case managers, there's approximately 4,000 new jobs that need to be developed. People need to be trained to do those jobs. So really focusing on professional development for our staff. So these are the 5 objectives that were approved in the long-term strategic plan. In addition to these 5 years objectives, the mission, vision, and value for the cluster was approved. And so the next phase, which we will begin, is socializing the plan in much more detail with everyone at KFSH, but then also looking at how does KFSH interact with the other hospitals, the other primary care centers, with the cluster to make sure that we are fulfilling our role within that. We've started some of this work already within the transplant service line where we're looking at service lines. How do we really fill the gap across the cluster? Obviously, we'll have to do the same exercise around cancer and neuro and really make sure that from a cluster standpoint, the sufficient resources are there. The goal is that we take from the chaotic health environment to one where really the patient is not seeking their care, but we are helping navigate the patient through the care process. And it starts with the primary health center. It starts with having a care coordinator assigned to every member in our population that can help them understand what they currently need, where to go, and then also educate them on how to improve their overall health. So again, this is a very quick introduction. We'll be doing a lot more rollout over the next couple of months. We wanted to start this earlier, but obviously with the COVID restrictions, it's hard to do this, and it's an important subject that's critical to have in-person discussion so that it's not just a one-way discussion, that we can have feedback and understand what you as the end user or the person that's actually doing the work believes and thinks where KFSH can play an important role. We kind of have our toe dipped in this right now, and we're really trying to figure out what's the right role for KFSH and how do we make sure that we provide a good product. The reputation from a KFSH standpoint is very strong. regionally and nationally. And so whatever we do, we want to make sure that we do it right so that we can continue to keep that strong reputation throughout the kingdom. So again, a brief introduction. We'll begin to communicate a rollout plan to the entire hospital, and we will look forward to your engagement.
Thank you, Mr. Sharif. Now will be with appreciation of all the champions of King Fahd Specialist Hospital, and Mr. Sharif, he will be the one who will say it for the reason of the champions. Please.
Again, we did this, I think the past either one or two times, but we really wanted to acknowledge, we get a lot of feedback from our patients, whether our patient satisfaction survey, 937, or informal verbal communication. And I know normally all you hear is the bad things of what went wrong or why did we do this, but we do get a lot of positive feedback from our patients as well. And so we wanted to begin to acknowledge those providers that our patients have mentioned directly to us. Again, I know there are a lot more people that are doing great work, and this is not intended to leave anybody out. But these are the people that our patients specifically mentioned over the past quarter. And we have certificates, I think, for everybody. But again, because of COVID, we have a couple of people here, but we will bring those certificates to your department to present to you in person.
Now, the people or for our champions is Dr. Ahad Zaidan, Dr. Aisha Duwahi, Dr. Ali Al-Mu'min, Dr. Bakhit Al-Matar, Dr. Imad Al-Ataibi, Dr. Fatima Al-Mubarak, Dr. Hamad Al-Shahrani, Dr. Ijaz Saoud, Dr. Manal Al-Hazmi, Dr. Muhammad Al-Jum'a, Dr. Muhammad Al-Qahtani, Dr. Musa'ad Al-Zahrani, Dr. Musa Al-Abbas, Dr. Umar Balla, Dr. Osama Al-Saif, Dr. Samih Abdel Mani, Dr. Suzanne Al-Ghamdi, Dr. Taghreed Al-Rishedi, Miss Leah Osa, Miss Zahra Al-Hmoud, Miss Suad Al-Moulad. Congratulations to all of our champions and all of the certificate they can receive from their departments from the secretary. Now we'll be with question and answer for the staff with Mr.
All right, I think I've said before, this is my favorite part, which is the open questions and really try to clarify any rumors or gossip. I can tell you still, we've gotten some questions, but most questions surround pay. But I really do want to encourage everybody to, if you have any questions, if you have any things that you want to clarify, please submit the questions, as we're happy to be transparent on all the subjects that are being received. I'll start with the one that's not pay, and then we'll go back to the others that are pay. So the first question is, why are administrative staff not required to have annual medical examinations? This is a decision that was made in the past, but really the emphasis behind it is we want to make sure that the people that are actually providing clinical care are physically well enough to do that care. Obviously, in an administrative position, some administrative positions, it's less physically taxing and less critical in terms of, from a mental state standpoint, if we make a decision, most decisions administratively we can fix. Clinically, we want to make sure that we have healthy and competent providers in this space. So it really the decision revolves around the fact that clinical people are putting their hands on patients or are interacting with patients, and we want to make sure that everyone is good. And alhamdulillah, I think for the most part, 99.99% everyone within the hospital is healthy. The next two questions are fairly specific, and then I'll talk generally. Well, I'll talk generally about pay first. I can tell you from a compensation standpoint, a lot of the questions that we've received is more specific to an allowance or an increment or something like that. Just from my standpoint, from a philosophical standpoint, it's important to me that we follow the policies and the rules. The reason I say that is because compensation is already a very difficult thing to do, and it's rarely anybody's ever happy with their compensation. So it's really critical that we follow the policies and procedures that are set by the Ministry of Health, because we know if we do that, we at least are being equitable from a policy and procedure standpoint. And that way we can stay out of any favoritism or inconsistencies that further create problems in the future. With that said, we do have, through a various number of audits that we've received over the past couple of months, we do have inconsistencies in our current pay practices that we are trying to address in an appropriate way. Some of these inconsistencies or all these inconsistencies, honestly, are not the fault of the employee. And therefore, as an institution, we have to figure out how do we correct the matter without harming any of the employees for decisions that were made. So it's not an easy task. We're sensitive to the fact that compensation, everybody depends on compensation for their livelihood. This is how you live. But at the same time, we have to figure out how to stay within the rules and the laws of the kingdom. So first, which is not a question, but that we received on paper, but I've heard enough general questions about it, is the annual allowances. We do plan on doing annual allowances this year, inshallah. My goal is that we can do this in the month of March and finish it. The reason that we haven't done the annual allowance so far is because there are some inconsistency with some of the employees in a couple of the previous year increments. We believe we have a pathway forward where we can move past these inconsistencies and then implement the annual allowance. But we've submitted our request and we're waiting for formal feedback and guidance. We believe that we'll get this guidance within the next week or two. Once we have this guidance, then we'll be able to move forward with the annual increases. So inshallah, I fully anticipate that we will be able to do the increments in the next 30 days. But it's important that we don't want to do something that creates further issues. We want to fix the problem, which we believe, as I said, we have a solution, and then we'll move forward with the annual increases. Specific questions around compensation is for charge nurse allowances. They've been canceled as it was on hold since March of 2020. Has it been canceled as it's been on hold since March of 2020? It's not been canceled. It has been put on hold again because of policy and procedure. It's actually not a charge nurse allowance. It's a nature of work allowance. We do have the solution for that, so we'll get it rectified. I'll work with Mr. Abdullah with nursing to make sure that the communication goes out to everybody on what's the proper pay practices, and we'll re-engage the staff with the charge nurse allowance. The second one, which is around critical infection allowances. The question is, why is non-Saudi nurses receiving critical infection allowance and Saudi not receiving it for the same job description? I can tell you that infection allowance created a lot of issues this past year, and I understand why. So it was a new allowance that was being introduced, and what we received from the ministry is, who do you believe should be part of this? So we submitted a list of job titles of who should be part of the allowance, and that was a national exercise. The ministry then published the job titles that are part of the infection control allowance. So again, it's important for us to follow what's the law or the policy and procedure. So we will pay the infection control, infection allowance, but it's based off that. The difference between there is no difference between the non-Saudis and the Saudis. The non-Saudis who are receiving it, it's based off nature of work and not necessarily infection control. And the Saudi nurses that are on the old scale, frozen on the old scale, are also receiving it. The ones that are not receiving are Saudi nurses that are on the new scale, as they're not part of that eligible group. So again, I know that sounds confusing, and honestly, the whole pay is confusing. But the important part is that if we have any specific questions, if any of you have very specific questions, please go to HR, please go to your supervisor so we can, if any of you have very specific questions, please go to HR, please go to your supervisor so we can address your questions specifically. Again, if we are doing something wrong from our pay practice, then bring it to our attention and we'll rectify it according to the appropriate policy and procedure. I know it's, anytime you hear audit, it's always thinking, oh, there's a bad thing. I can tell you in some cases, we've identified where people should be making more because they're not on the right scale. So if you feel like you have a question about your compensation, please reach out to your supervisor, make an appointment with HR to do your review so that you feel comfortable that you're being paid appropriately for your job. Again, I want to encourage you moving forward. If there's other questions, I'm happy to answer payroll questions, but if there's other questions about the hospital's strategic focus, any questions about ongoing operations, please let us know and we're happy to address any of those questions. So I think the two main takeaways for me today is one, on the COVID vaccination. We want to encourage everyone to get vaccinated. We have plenty of supplies, and I know the nursing team has done a good job to put together a format where we can really vaccinate as many people as possible. Our goal is 100 of our employees and their family members a day. So please schedule your appointment. If you have family members that you'd like to be scheduled, please do so as well. And then the second is on the safety survey. I'd encourage everyone, if you haven't done it, to take the time and fill out the survey. Thank you all for your time this morning. And again, we appreciate all the hard work that you do day in and day out. And if there's anything you need from myself or any of the leadership team, we're here to help you.
Thank you, Mr. Sharif. At the end, I hope nice and a quiet weekend to all of you. Be safe, please. Thank you.
Thank you.
Thank you so much.